I was at work, and then my wife gave me a call and told me there was an earthquake in Haiti. When I'm on break, I can give her a call to find out about the details of it. And then when I give her the call, and then I thought it was a simple earthquake, and then I found out it was a high magnitude earthquake, and I didn't know that if it was that high. And I was at work when I learned that, and I didn't know if the devastation was so great. There was a lot of frustration in my family here because we don't know if my mother was under the rubble, if my brother was under the rubble, and we don't know where anybody were. My nieces, my nephew, and it was a complete chaos. Supervisor sent an email saying that, they're looking for a volunteer to help with the devastation in Haiti, and I was the first one to put my name on the top of the list. I said, if you give me 3 hours, I'll leave. And then I packed my bag and leave, and this is a good opportunity for me to help my country, because without this hospital, I wouldn't be able to do it.
MGH was founded by the state of Massachusetts in 1811 to care for poor people. And in fact, in the circular letter that was written to the rich people of this area to help create this hospital, it refers to the hospital being created such that when in distress, every man is our neighbor. So I think that really describes the soul of this hospital very, very well. And I think when we think of our neighbors, we think about people not only locally, but at far distance from the hospital as well.
People expect us to be involved in global health. So our patients and all the people around us in our public, whether it's our senators or congressmen, the business leaders, they will call and say, when are you going, not if you're going. And they call right at the time of disaster, whether it's Haiti or tsunami or Katrina, and they will say, we want you involved. So it's part of our heritage, it's what we do well, and it's something I think that we're expected to do.
Preparation for humanitarian work happens through educational sessions that the center hosts, and then preparation happens in the moment at the time of the disaster. Because each disaster has been unique, it's very important that we prepare people for the individual disaster, for the patient population.
The nurses and doctors that work at home and cover for us are an equally important part. But one of the interesting things is our team is really the MGH. Everybody from equipment management to nutrition, when they hear we're deployed, comes to us and says, what do you need from the MGH? So we have a real support group at home, which is important. And we come not only with our team, but we come with the fact that the MGH cares about the victims of the disaster.
Tom Durant was a legendary Mass General physician, and much of his life he spent not only working at Mass General but also serving abroad in the refugee camps. So if there was a crisis, Tom was there, and that goes back into the 60s in Vietnam and for there. The newspaper columnist Kevin Cullen said that you could track the world's miseries by where Tom Durant served.
From Tom's legacy, the Durant Fellowship was born. The Durant Fellowship is a highly competitive fellowship, primarily for physicians and nurses who want to make a contribution.
So I was the first fellow and spent that year on the Thai-Burmese border in refugee camps. And that was one of the best pieces of advice I got from Tom. Is he was like, you need to get in the field. You need to get your hands dirty. And from there you can decide how you want to work in the field. But if you keep filling your toolbox in training and waiting until you're done, you just may never do it because life gets in the way. And I think that's one of the great opportunities of the Durant Fellowship.
I was one of the first Durant Fellows in refugee medicine. and I was lucky enough to be deployed to Western Darfur, Sudan. We're so blessed by having the opportunity to learn and grow in our practice at Mass General. We have such qualified individuals. We're always encouraged to grow in our practice. Where there is great privilege comes great responsibility. And I feel that because we are so privileged to work at Mass General and be a part of that institution, it is our job to give back to people who are less fortunate.
You don't have to do anything but make one of these trips to realize how overwhelming the healthcare needs in other parts of the world, and how people from the United States can make a huge difference. So I think making one of those trips makes you even more passionate about this area of work, and I think makes you feel much more fortunate that we live where we do.